start of the night shift for Dr Felicity Martin at Melbourne's St Vincent's Hospital.
Tonight I'm heading off to a shift in ICU. It's actually my last shift in ICU, and then I'm moving back to the general medical ward where I'll be working on the COVID ward for the next few months. I think it's fair to say it's been pretty stressful the last few months. There's a lot of fear. Watching the numbers of COVID patients on the ward go up can be a bit scary at times. I think we all get glued to the numbers.
The 29-year-old registrar has been cleared to return to the rounds after contracting COVID a few weeks ago.
I had atypical symptoms. I didn't have a fever, I didn't have a cough, I wasn't short of breath, and I actually just mainly had some chest tightness and a bit of a throat tickle, and then I felt quite fatigued. I think it was pretty stressful at first. I kept on thinking, how long have I been infectious for, who might I have passed the virus on to, and how sick might they get?
A big fear was whether she would spread the virus to her husband at home.
Luckily, my husband, we were able to physically distance from each other, and he didn't contract the virus either, so very lucky in that regard.
Several of Felicity's close contacts at the hospital were also isolated, but thankfully none contracted COVID. It's still unknown how she got it.
I took all the precautions I know, and our hospital's been extremely stringent in protecting people as much as they possibly can, but this is an invisible enemy, as we keep saying. It's we can't be 100% sure that we've controlled it, and it's incredibly contagious. So whether I caught it in the community or whether I caught it at work, it's just very hard to say.
Fear among frontline workers is growing, with several peak bodies demanding better protection in the workplace. A survey of medical staff found 20% had to source their own protection, and about half had limited or no access to higher grade masks.
For most staff, there's a bit of fear about contracting the virus themselves. We know we're in the sort of direct path of the virus, and despite our best efforts, it's incredibly contagious.
We don't know for sure why healthcare workers are still falling ill. We suspect it's a combination of healthcare workers who are not being adequately protected by their personal protective equipment, but also there are other ways you can catch COVID in a work environment, such as if one of your co-workers has it.
In Victoria, more than 1,700 healthcare workers have been infected. About 1,000 still have COVID.
Doctors, nurses and aged care workers are contracting this disease while looking after patients, and that is a completely unacceptable situation. And the worst thing is, it's a preventable situation.
The newly elected AMA President, Dr Omar Khorshid, wants all healthcare workers dealing with suspected or confirmed cases around the country to wear N95 or P2 respirators, which offer more protection. But at a national level, the body of experts advising the federal government has recommended the use of such masks only in extreme circumstances.
We cannot understand the logic behind that, and we're very disappointed at this lack of commitment to healthcare worker safety that we're seeing.
The Federal Health Department has told 730 that based on evidence, the body of experts doesn't believe there's any additional benefit of using higher grade masks in the routine care of COVID cases.
Hi, this is our house. Very small. Sophie's in the background. Can you wave, Soph?
Further north in Coburg, Wendy HAIGH ventures out of home lockdown to work as a casual nurse at a COVID testing site.
We're more restricted, and I just think we're all over it.
Put your mask on.
Wendy's eager to work, but has struggled to find childcare for her daughter. As an essential worker, she needs a special permit.
This is ready to pick.
This is the part of the permit that is driving me a bit crazy.
But because Wendy's shifts come up at the last minute, she can't always get a permit in time.
When you're like me and you do not get that phone call until 5 o'clock in the morning for a 7 a.m. shift, it's problematic, and it's going to, I think, make the casual nursing workforce not being able to accept shifts.
Families around Melbourne are feeling the financial effects of the lockdown, and over in McKinnon, in Melbourne's southeast, Matt Thorpe's mowing business has been shut down.
With the 6-week lockdown, obviously unable to work, so my trailer, which is sitting here, will continue to sit here for the next 6 weeks.
Spring next month would have been the busiest time of year for him.
It came as a real kick in the guts, and I guess there's no other way to describe it. For me personally, financially, yeah, 6 weeks without income is going to take its toll. I have 2 young children that are, one's in year 7 and one's in grade 4.
But Matt will follow the rules, despite the gym's mowing founder promising to defend franchisees against lockdown fines.
I don't think it's a good look. It's not a great look for the brand itself. And it's certainly not a good look for me to be driving around. I want to do my bit just like everybody else.
Victoria's lockdown is tough medicine, and there's no end in sight to the pandemic.
When you have so much community spread of this virus, is that it may be impossible to completely eradicate the virus from Victoria.
This is the reality we're living with, and I very much hope that if everyone follows the guidelines, we can have a short period of lockdown.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.